Hello viewers, I am Dr. Shashant. I am a clinical andrologist at 49 Hospital, Secunderabad. Today we are going to discuss about the tests that are needed for the sperm evaluation before IVF. So the important test to be screened for a husband, that is the male partner, before the couple has decided to opt for in vitro fertilization is semen analysis. In semen analysis, the number of sperms, that is the total sperm concentration per ml, is checked. Then the next parameter is the movement of the sperms. So at least 40% of the sperms in the semen sample should be motile. Around 32% should have a forward progressive motility, and around 8% can have a non-progressive motility. So totally 40% of the sperm should be motile. And third comes the morphology. So that is the shape and the size of the sperm should be within the defined criteria. So normal appearing, normal looking sperms, at least 40% of the sperm should have good motility. At least 4% of all the sperm should have a normal looking appearance. And the minimum sperm count in a healthy fertile male is 15 million per ml. So today we are going to discuss about a procedure called as ICSI, which is ICSI. So intracytoplasmic sperm injection. In this procedure, a patient which is having low sperm counts or low sperm motility and morphology, abnormal appearing sperms, in such a procedure, the fertilization rate can be improved by a process called as intracytoplasmic sperm injection, where the sperm is selected, a healthy, motile and normal looking sperm, it is selected and it is inserted into the woman's egg that is retrieved at the time of the egg pickup. So after this process, the success rate of fertilization is far better. It has been noted in research to be far better. So in our center, we usually opt for ICSI in IVF cycles for all patients who are having a low sperm count or a low motility. Next is the test called DNA Fragmentation Index. In DNA Fragmentation Index, basically what it means, first I would like to explain. So every sperm contains information in the form of DNA, and usually the sperm is very tiny. It is just a transport vehicle for the DNA to reach the woman's egg, which is also having a nucleus and its own DNA. So what happens, the DNA is compacted into a small vehicle which is the sperm. Sometimes there are some breaks in the DNA, there is some damage or some errors in the DNA, and usually the reason for a fragmentation of DNA, common reasons are age of the husband, of the male partner is very important. Secondly, it can be the smoking, alcohol, substance abuse. So that is known to cause DNA fragmentation as well. Third common cause is varicocele. So varicocele can cause local heat. So even any condition that can result in heating of the testicles, for example taking very hot water showers or wearing very tight undergarments, so and laptop usage excessively. So the heat of the processor continuously near the testis can cause increased DNA fragmentation, and it can damage the sperm DNA. Then exposure to some toxic compounds. So particularly occupational hazard, where patient is working in metallic industry or paint industry or plastic industry, automobile industry, wherein they are exposed to some toxic chemicals or any other medicine use. Then any chronic illnesses, this is also a cause for DNA fragmentation, particularly uncontrolled diabetes or endocrine disturbances. In some cases, even genetic reasons can cause increased DNA fragmentation, Y chromosomal microdeletion. So some genetic reasons as well. So what can we do to reduce the percentage of the sperm with damage. What can we do to reduce the DNA fragmentation? So the test name is DNA Fragmentation Index. It can be done by some methods in the modern day called tunnel assay. And now in the new research, what they say is that, is there a role for routine testing for DNA fragmentation? As per the American Society of Reproductive Medicine, they do not recommend the routine DNA fragmentation analysis, because the modern day techniques, they do not determine the improvement in the outcome of the fertility. So in the DNA fragmentation, we can give some antioxidants, but research has shown that even use of antioxidants such as vitamin E and coenzyme Q10 does not significantly improve the DNA fragmentation. So then what next can be done so that the fertility potential of a fragmented DNA sample, a patient who is concerned that my sperms are having high DNA fragmentation, what can I do? How do I improve the success in the IVF? So in such patients, there is a test called as a HBA, hyaluronan binding assay, wherein they check the binding capacity of the sperm to the hyaluronan substance, which is basically the outer capsule of the egg. And also there is a research going on for another technique which is called microfluidic sperm selection. So in this, the sperm is passed through very fine channels, and the sperms that are able to pass through these channels are usually the healthy sperms, so they can be selected in that way. So these are the two new modern techniques, and of course intracytoplasmic sperm injection has improved tremendously the success rates in IVF. So ideally it should be the mode for male infertility. It can overcome even anti-sperm antibodies and many other adverse findings in the semen analysis. So I hope this information was useful to you. If you have to take an appointment or you want to have a consultation, I am available Monday to Saturday at 49 Hospital, Secunderabad, and my timings are from 12 to 5 p.m. every weekday. Thank you.